As COVID-19 cases go up again, many questions are going to arise. But the one that's perhaps most critical is, how can we live safely alongside the virus in the months, indeed years ahead, and begin to reverse the devastating, unprecedented economic damage this virus has wrought upon the country? And we need to ask this now, because action's required now. We know that we're treating the disease more effectively than before, and the death rate is falling. But we're also learning more and more about the lasting impact of COVID. So our strategy can't be simply to lock down and hope the virus goes away. It's not going to. A second wave proves that. Instead, we need a strategy which protects our most vulnerable, reduces hospitalizations, prevents transmissions, and can quickly be deployed to halt outbreaks. This means replacing lockdown with 4 key measures: vaccines, therapeutics, testing, and data. Each pillar includes new innovations that are within our grasp and which we have to bring online, consistent with safety, but without any unnecessary delay, building the infrastructure and condensing the regulatory processes where we safely can. First, on testing, the government's got to organise the provision of rapid tests so that we're testing people rather than quarantining them, and we're catching asymptomatic cases as well as those with symptoms. At the same time, where we know from experience there are potential outbreak settings, such as universities and secondary schools, we have to support them to introduce regular mass testing. Second, on therapeutics, we've got a number of immensely promising drugs, including the monoclonal antibody cocktails. Every patient who would benefit from these should be receiving them, shifting eligibility also to those outside of hospital who become infected and are deemed at risk of going into hospital. Third, on the vaccinations, again, consistent with safety, we should shorten every element of the vaccine approval process so that as far as is humanly possible, we aim to get the first vaccines underway before Christmas. Data from around the world shows that with the particular vaccines we're talking about, there is no major safety issue. Even efficacy at 50%, so that it reduces the severity of the disease by 50% at least, is worth having, because that in itself will save lives and mitigate significantly the severity of the illness. And fourth, all of this has got to be underpinned by a robust data system. This should record and connect the tests one takes, the vaccines people receive, the drugs they're given, and all of it has to be entered on the best possible database to provide us with the insight that will sharpen our response and underpin long-term planning for solutions, including your own health passport that will allow you to travel. Britain is well placed in theory for a second wave. We've probably the best vaccine in the world, probably the best therapeutic drugs, and at least some of the best testing devices. But we need to get organised. And these are key decisions that have got to be taken now so that we shorten the time in putting in place those 4 elements that will allow us to make this lockdown the last lockdown that we have. And a constant theme in this crisis, don't let the best become the enemy of good enough.